Hello, everyone, and thank you so much for joining us this evening in honor of Women's Eye Health and Safety Month. I'm Prianka Persad, Surgical Services Manager at Trinidad Eye Hospital, and your host for today. First of all, would like to just apologize to everyone that was looking forward to last week's session, but unfortunately, we had some technical challenges and we were not able to host the session. However, we are on tonight and we are really happy to be here to share information with you all. This evening, I'm joined by two very passionate eye care professionals at Trinidad Eye Hospital, Dr. Bibitayo Fagbola, resident in ophthalmology, and Mr. Sean Bridgelal, optometrist at the TEH Optical. Welcome to you both, Sean and Dr. Fagbola.
Thank you, Priyanka. Nice to be here.
So today we're going to dive into some real conversations about women's eye health and women's safety, eye safety that is, and also talk about issues that specifically affect women, how we as women should spot these issues, and how we can take better care of our vision in general. So getting right into it, we'll start with Dr. Bibi. Why is it that April is given such importance and such special attention in regards to women's eye health?
Yeah, so globally, well, April is the month of women's eye health and safety. And, I'm really glad that we're taking advantage of this opportunity to spread awareness. Now, some may not know, but women's eye health should be given special attention because overall, women are affected more by eye diseases and have a higher rate of vision impairment and vision loss compared to men. Now, there are four very common eye conditions that women are more likely to develop than men. And I'm just going to briefly mention them. Some of these we've heard, perhaps our audience have heard of all of them. So, dry eye syndrome, where there's decreased tear production or not enough tears to lubricate and moisten the surface of our eyes. Cataracts, which is when our lens becomes cloudy. Glaucoma, where there's damage to the nerve that connects the eye to the brain. And then there's what's called age-related macular degeneration, where there's damage to the area of the eye responsible for central vision, for seeing directly in front of us. All four of these common conditions can cause mild to severe vision changes. And what contributes largely to these changes are hormonal changes that occur throughout a woman's life: pregnancy, menopause, the use of birth control. Autoimmune diseases like lupus and rheumatoid arthritis, which are common ones, and these also occur more commonly in women. Chronic illnesses like type 2 diabetes, and also the fact that on average, we know women live longer than men. And so it stands to reason that the longer we're alive, the more likely we are to develop some sort of condition related to the eye. Common examples of this are cataracts, and like I mentioned earlier, age-related macular degeneration, which typically begins over the age of 50. So four very common eye conditions women are more likely to develop.
And Doc, you mentioned that women experience hormonal changes. Is it that we look at a specific age group for this, or is it women in general? So women in their 20s, 30s, etc.
Yeah. So at each age group, there are different hormonal changes that will occur, some affecting one age group more than the other. So, for example, pregnancy, you're expecting women from the time of, let's say, post-pubertal 16, 18 until the age of 35. So the peak ages of fertility. And then, of course, there's menopause as women begin, as we hit the age of 50 and above. And so you see that within almost every stage of a woman's life, she's most likely to undergo some sort of hormonal shifts. Not to also to mention the menstrual cycle, which almost every woman would experience, and that as well induces hormonal shifts. So I don't think as women we can get away from undergoing these hormonal shifts, Priyanka.
Unfortunately. Um, But I mean, also from a surgical side of things, we notice that we do see quite a bit of women coming in for surgery, and it's mainly cataract surgery, but they come in at a point where their vision has already been severely affected. And from something as simple as cataracts, which is so easily fixed by simple surgery. Um, and I just wanted to point this one to Sean. Do you find that there are a lot of women that come in for eye testing or glasses, or is there still a delay in women getting that sort of testing?
Well, it really tends to vary. Most women are proactive, but also a large percentage of them, they're juggling their daily lives as well as their responsibilities with family and job. So the eye health tends to take a backseat until it starts to affect their daily activities.
Yeah, and it's quite unfortunate, really. But Dr. Bibi, you mentioned also earlier about dry eyes. So can you tell us a little bit about how dry eyes affect women and what other common eye conditions women can encounter?
Right. So a lot of the dry eye issues really comes down to the hormonal fluctuations, right, that I mentioned earlier. Not to get too scientific, but there's a very important sex hormone called estrogen in women, and this plays an important role in regulating many of our processes. So the menstrual cycle, for example. Fluctuations in that hormone, whether too much or too little of it is being produced, disrupts normal processes in the body and also in the eye. So what's interesting, what's fascinating is that estrogen, right, plays a role in tear production. And it helps some of the glands in our eyelids to function properly and to secrete, what they need to in order to keep the surface of the eyes lubricated. And so if there is not enough estrogen, tear production decreases, and the glands also don't produce as much oils as they should to help lubricate the surface. And of course, that would lead to the whole sequelae of having dry and irritated eyes.
Okay. And Sean, is there anything specific in terms of common eye issues on the optometry side of things that we should note?
Oh, just as Dr. Bibi was saying, we tend to notice more around menopause and perimenopause that the dry eyes become a little more uncomfortable due to these hormone fluctuations. You have the typical refractive error, so long-sightedness, short-sightedness, and then you have that big one called presbyopia, which happens when you hit 40. So typically, people in general, they find that they have to bring the print back a lot further back to see clearer. And the women in general, they tend to notice this a lot sooner than men because they tend to have shorter arms. So it's less room to notice. But in general, they seem to be more proactive. So yeah, those are the main ones. Of course, with the screen time also, you tend to notice these things with the computer vision syndrome.
And that's it. A lot of people just think that vision loss is part of normal aging or just a routine part of every day. So we'll go to the pharmacy and just pick up something on the over the counter and use it. Is that recommended?
No, not one bit. Always consult your eye professional. Reason being is the pharmacist might know exactly what's going on in the eyes. They just have your information, but we have the testing and the results to back it up. So we'll give you something very specific for your problems.
And Dr. Bibi, do you recommend that we should have dilated or comprehensive eye screening at a particular age versus just going to the optometrist for our glasses testing?
Right. So, at around, let's say, the age of 30, 30 to 40, but specifically 30, it's sort of a critical age because we noticed that there are a lot of natural aging changes that are occurring in the lens, right? And in other structures in the eye. It's the same way how we say, as you're getting old, your bones getting old, and so on. But scientifically, the structures are changing, they're getting weaker. So the lens are getting weaker, processes in the eyes, the eyelids are not functioning as they should. And so as that age, as we get older, especially when we hit the 35 and 40, we should be a bit more proactive with the eye exams. Now, it's not to say that you shouldn't have eye exams. I would say that from childhood, eye exams should be regular every 2 to 3 years or so. But as we are leaving the teenage years and going into adulthood, we should strive to have an eye exam every year, whether or not we have an underlying condition. We talking a lot about dry eyes and what they can cause, and I just wanted to touch on some of the symptoms, that are very common on dry eyes and what persons who are listening can sort of look out for. And some of you may already be experiencing it or you have experienced it. Common things are like feeling a gritty or sandy or burning sensation in the eyes. So I know Sean probably hears this a lot. You hear this a lot, right? They come in and they swear there's something in the eye, and no matter how often they rub it, it's not coming out. All right. And when we examine them, it's because there's nothing in the eye. The surface is just so dry that it's giving you that sensation. You find that your eyes look redder than usual. You wake up in the morning and the eyes are red and you didn't put anything in it. And so some patients get scared. They think, oh, is it an infection in the eye? Why is my eye looking red? They also find that you might experience a discharge or something like cold or mucus that's coming from the eyes. Eye strain and sensitivity to light. So when you're looking at something, the eyes burn a little bit, you find that you can't look at bright objects for too long. All of these common. The eyes also tend to water more than usual. And that's another thing persons find strange. If my eyes are dry, why are they watering more than usual? And that's because the normal mechanisms are disrupted, right? So all of these things are very common symptoms in dry eyes, but it's important to know that they don't only happen in dry eyes. And it relates back to what you mentioned earlier and what you and Sean were saying. If you're experiencing any of these changes, don't self-treat. So don't just say, oh, well, I heard Sean and Dr. Bibi say that these are symptoms of dry eye, so let me just go to a pharmacy and pick up an eye drop and put it in, and that should help. There's so many eye conditions that have the same symptoms. And so treating yourself without knowing what you're even treating can do more harm than good. There's actually a patient, if you don't mind sharing, a patient who came in for the first time. She was using a very common eye drop, a lubricating eye drop, because she experienced a lot of those symptoms and she thought that was the problem. That was the only problem. But the symptoms were persisting and she decided to come in. And that was her first time seeing an eye doctor. And just by the first thing that we tend to do is check the eye pressure. The pressure in her eyes were very high. And as the exam went along, we saw that she had changes that were consistent with glaucoma, with the nerve to the back of her eyes having some damage to them. So yes, she had dry eyes, but she also had another condition. And so it's really important that any changes in the vision, whether they're happening over time or they're sudden, don't stay at home and self-treat. Find your nearest eye clinic, eye doctor, optometrist, eye care professional who can recognize if there's anything wrong and determine the next steps. So I felt it was really important to mention that because I know some persons, experience some of these common symptoms. And it's just to let them know that we want to discourage the idea of treating yourself at home because that can do you more harm than good.
Thank you so much, Doc, for sharing that story. And I know we're talking about women's eye health, but as you mentioned, this patient's story, and you spoke about glaucoma. I know it's called the silent thief of sight. So what specific symptoms should somebody look out for? Or is it only that it could be determined that you might have these symptoms through a dilated or comprehensive eye exam?
Right. So the scary thing about glaucoma and why it has its name is that you can go for years without having any symptoms. So there's damage being done to the back of the eyes, to that nerve, and your vision is fine. You're seeing well, you're reading well. And then as the years go by, you find that you're having difficulty seeing both near and far. You find that objects, things in the middle of you, in the center of you, look clear, but around it starts looking a little fuzzy, a little blurry. You find that at times you may notice there are certain little black spots or dots in your vision that happen randomly. So again, not specific for glaucoma, but common symptoms that can be associated with it. Another one that's common is eye pain randomly. You find that sometimes the eyeball is hurting and you're not sure why. And it points back to any changes in the vision. Don't ignore it.
So we have a couple questions. So the first question says, my mom is 60 and she says she's seeing floaters. How are floaters formed?
Right. So to the back of our eyes, and I'm not going to, be too scientific, but there's what's called the vitreous gel, right? And it's a gel-like substance that fills our eyeball. As we grow older, naturally, that vitreous breaks down, right? It gets thinner, right? The gel gets thinner. And when the gel thins, think of little bubbles, a gel that's thinning out, little bubbles then start, spreading across the back of your eye, and that manifests as those little black dots and lines that you see that we call floaters. So that's the commonest, cause of them. We actually call it posterior vitreous detachment if that gel has, pulled away from being attached. Or sometimes we just call it vitreous degeneration, meaning that the gel is breaking down. So that's what's common. Note though that more severe conditions can cause floaters, right? And this is one we see, unfortunately, quite often called retinal detachment. And it's when the retina, the film that you can say holds the back of the eye together, when that tears off, you can also see floaters, right? And there are other conditions too, but the common cause for most floaters is the vitreous gel that's breaking down. Does it go away? Most of the times, no. Sometimes what happens is that the gel, it gets smaller, the floaters get smaller, so you find you're seeing less of it. And then you just get accustomed to seeing them. What to look out for is if those floaters are becoming more numerous. So you're seeing them and you're seeing them quite often. So they're becoming bigger and you're seeing them quite often. And that can be an indication that there's something more than just a vitreous detachment. So just, simple tips to look out for.
Yeah. And moving right on with the questions, can birth control affect your vision as well?
So that's a really still a great area for us eye care professionals. We have seen a few cases, right, in clinic where women who recently started oral birth control started noticing some changes in their vision. And it has been difficult to determine or to confirm whether those vision changes were as a direct result of the birth control or they had something else, another condition that was compounding it. But there are research studies that show, yes, there are birth control methods that can lead to some changes in the eyes. So you can get bleeding, actually, and to the back in the vessels, the back of the eyes. You find you can also get sudden loss of vision. Thankfully, we have not seen a lot of those cases, but they do exist. So it's important that we mention it so there's awareness. What I would recommend is that women who are taking birth control on birth control methods, whether it's oral birth control or the patch or it's inserted vaginally, that you have a full blood test done. And what that does is it looks for any conditions that will predispose you to developing clots. So for example, having a clotting disorder or having an abnormality in the blood can interact with the estrogen and estradiol levels that are in a lot of these birth control methods and put you at a risk for actually getting bleeds in the eye. So again, not common, but it has happened. So important to know. So to answer your question, yes, there has been a link between birth control and changes in the eyes.
Thank you so much, Dr. Bibi. So let's just get back to the topics of discussion. And Sean, you had mentioned earlier about turning 40 and holding the paper really far away and presbyopia. But can you explain a little bit more about presbyopia and what should we look out for really?
Yeah, well, the typical onset of presbyopia is 40. For some people, 39, for some people, 42, depending on their prescription itself. But typically what happens is as you age, the lens, it tends to get thicker. It gets more layers like an onion. And then when we look at things near, our eye muscles will tend to bend the lens to focus. But as the lens is more thicker now, it's harder to bend. And it's to the point that the eye muscles reach their limit, so they can't do the bending that they should. So you find that you could focus well at near for a while, and then everything goes completely blurry, the eye muscles just give up. So to compensate for that, we give some reading power, which is known as multifocal lenses, or progressive lenses. So yeah, essentially, presbyopia is just like a natural aging process. It's just a checkpoint that we all reach. And how we tend to notice it usually is when the near vision starts giving trouble, and you have to push the print back to switch more into distance vision, so you get less effort into that.
Okay, and the glasses that we find in the pharmacies that say plus 1.50, these are okay for us to use without having seen an optometrist?
I wouldn't recommend it. Well, definitely not without an optometrist. So these that mass produce are basically a one size fits all, and they only account for a certain demographic of prescriptions there. So a lot of us have astigmatism, which is a very specific power and a specific orientation. So these glasses aren't able to accommodate for that. So yes, you may get the extra power at near, but it is essentially only using half your prescription because the glasses can't compensate for that. So you may be placing a further strain on the eyes.
Very interesting. Okay, so there is another question. Do you need to do a blood count before eye surgery?
Okay.
Well, Dr. Bibi, you want to try and take this one?
Right. Yeah. So sometimes we do, sometimes we don't. And ideally, it should be done before any eye surgery because there are, again, certain conditions in the blood. So, for example, if you have a clotting disorder, that can predispose to you having higher risk of complications after the surgery. Now, usually when we see patients, they already are aware of if they have an underlying condition or if they have a disorder, especially if it's something as critical as a clotting disorder or any other kind of blood abnormality, because the symptoms for those develop earlier in life. So they usually know. But ideally, yes, a blood count should be done before any type of surgery.
Thank you. And Dr. Bibi, again, going back to the point that you alluded to earlier about hormonal changes, pregnancy, and menopause, what should women know about how pregnancy and menopause can affect their life and their eye health in particular?
Right. So we mentioned the big hormone, the major hormone, that's estrogen, and the shifts that happen. So for example, in pregnancy, you have a rise in estrogen, too much of a rise sometimes, and that disrupts the tear production. And it also disrupts how the glands in the eyelids secrete oil and help, disrupt the lubrication of the surface. Pregnancy also causes what we call fluid retention. And really, you just find that there's swelling. So a lot of pregnant women can attest to this. They wake up and they find the hands, the ankles, the legs, the feet look swollen, the face looks puffy, right? And that's because of fluid retention. And what fluid retention does is it changes the shape of what's called the cornea. So the cornea is the clear front part of our eyes that kind of acts like a window for light to enter into it. Right? And when that cornea changes shape, light doesn't enter the way that it should. And so you can see when fluid retention leading to changes in the cornea, leading to light not entering our eyes the way they should, can lead to blurry vision, can lead to other changes in your vision, not being able to see light or to read near or distant. Menopause, now you have a significant decrease in estrogen. And again, that disrupts the tear production, leading to dry eyes and all the symptoms we mentioned associated with such. And so often the reason why a lot of, why doctors recommend certain supplements for pregnant women and women who are pre, peri, or postmenopausal is because of these drastic shifts in these hormones. They're going haywire sort of. And you want to help get a balance, because without that balance, not are you just having other parts of the body affected, but the eyes too. So I think those are the two big ones that that's good that we talked about it, pregnancy and menopause, because there's significant changes for many women. Many women are going to undergo them. So it's really to know that the hormonal changes that you undergo in these conditions can affect your eyes as well. So when your doctors recommend certain supplements, there's a reason behind it.
And on that same point, if the vision is affected, it's usually recovered, or is the damage permanent?
Well, so it depends on you mean if the vision is affected due to the hormonal shifts?
Yes.
Usually it's recovered. If it is solely just because of the hormonal shifts and steps are taken to help restore that natural balance, then yes, the vision recovers naturally over time. However, if there's a condition, if you have another condition that's affecting the eye, a condition with the eye itself, for example, cataracts, or you have swelling or bleeding behind the eye, just restoring normal hormone balance isn't going to get rid of isn't going to solve the other conditions that are also contributing to you having eye problems.
Yes, certainly. So I think we had a really nice chat. So we're going to kind of wrap up today's session. So Sean, is there anything you'd like to say to encourage women to prioritize having their eyes get tested?
Well, definitely it should be a priority. You should always take care of yourself first, otherwise you can't focus on anyone else. So yeah, make your health the forefront. Our eyesight is very important and you need it for almost everything in life. Yeah.
Really important point. You can't pour from an empty cup. Love it. And Dr. Bibi, any final words?
Yeah, the eyes are, parts of the body, and so as the same way we make recommendations for anything, diet. So diets, just as how it can affect any other organ in the body, it can also affect the health of the eyes. So I would say to start there, of course, we know the focus should always be on more whole and natural foods and trying to consume as much fruits and veggies as possible. And there's a reason behind that too. We talk so much about vitamin C, but there's another also important, very important vitamin that perhaps we need to talk about more, and it's vitamin E. And that's one of the major players in eye function. Vitamin E helps protect the surface of the eye, so it can help protect against eye infections. Uh, you find that a deficiency in vitamin A can actually lead to decreased night vision and also cause dry eyes, right? And even changes to the cornea. So while we focus a lot on vitamin C, it's important not to ignore the other vitamins. And of course, one of the best ways to get that is to ensure a balanced diet. Where do we find vitamin E? Colorful fruits and veggies like carrots, sweet potatoes, spinach, kale, right? Or good amounts of vitamin E that the body is going to utilize. Um, Dairy, if you eat dairy, eggs, fortified cereals, oats, and so on. Uh, Second thing I would recommend is, like Sean said, be aware of changes in your vision and be proactive with it. Even if it's a minor change, don't ignore. We have this kind of this culture of we'll take care of it ourselves, we'll treat it ourselves, or if it's something happens, we'll just brush it off and hopefully it pass. So that's the mentality we want to discourage. The only way to know the health of your eyes is to actually have them tested. So third thing, eye exams. At least once every year, you should be having an eye exams. Of course, for persons who have certain eye conditions, we see them more often every 3 or 6 months. But for the general population or the average person who doesn't have an eye condition, we recommend yearly exams, dilated exams where we look to the front and to the back of your eye. And we know, and I mean, Priyanka, you know this too, a lot of times the reasons patients stay away from us is because they fear hearing something bad. Right? No one wants to hear that something is happening with the eyes. And it's understandable to have that fear, but it's better to prevent a condition than to try to cure it. And
Yeah.
so those are my tips for
Well,
eye.
thank you so much, both of you, Sean and Dr. Fagbola, for sharing your wisdom with us today. And thank you to everyone that joined in. Thank you for the questions. We hope that this session has inspired you to go to your eye doctors, go to your optometrist, get your eye tests and glasses tests and dilated eye exams done. Because remember, ladies and men, everybody, your vision is very important, like Sean said, and Dr. Bibi alluded to. It's really a gift and something that we take for granted, but it's only when you don't have it then you realize how it's important. So with that, we're going to close and thank you again, everyone, for joining.
Thank you.